guys, how you doing? If you're new to my page, I'm Mrs. Njoka. I live with a number of chronic illnesses. So today we'll be talking about the illness that has me going for surgery tomorrow. So I've had chondromalacia patella for the last 10 years. I was first diagnosed with grade 1 in 2012 and it has spiraled since then. Of course, we went on treating it as it spiraled, but everything that we tried to do was just not working. That's why we've said at this point it just makes more sense to go into surgery. Now, as I was going through this journey, first I'll explain what chondromalacia patella is. Your knee has different parts, okay? Has different moving systems. Your femur is part of the moving system of the knee. Then you have your kneecap, you have the patella, the kneecap, the bone itself, then the patella, then the fluid that helps those bones move. So normally, let's assume this is your tibia, and sorry, femur, forgive me. This is your femur and this is your kneecap. So normally they go hand in hand together. When this one moves, the other one moves because of the lubrication and the cartilage inside. So in my knee, the lubrication disappeared, okay? So it came a little bit closer together. Then as time went on, the cartilage that was in there wore off. So now it became bone on bone. Now as it was grinding bone on bone, the femur dug a hole into my kneecap, okay? Because it's trying to wear off the kneecap completely. Now on this hole, the doctor explained to us that my kneecap now looks something like this. It has a gigantic hole in it. Now when this hole was formed, the femur didn't know what to do because it knows there's not supposed to be a hole. So the femur started growing small jagged bones to cover that hole. So if you look at my MRI, my femur looks like I have shreds of paper. You know how when you shred a paper and then you don't shred it all the way? So it kind of looks like that. So my doctor is going to put in an arthroscope, which is he's just going to put a small incision in my knee, then put kind of like a camera, small camera thing with equipment. Then he's going to go in and shave off those bones that have been grown by my femur. So that's the arthroscope. Guys, I can't pronounce that name. My ara and eras as a Kikuyu is difficult. Okay, so that's the first thing we're going to do. The second thing we're going to do is correct my meniscus posterior meniscus root tear, which is, so again, if you've eaten a chicken before, when you pull that ligament for the hip, you normally see some cartilage that kind of looks like, it's not bone, but it's not flesh, that. So those are the ligaments that kind of hold your knee together. So mine, which is the posterior root, which is the one at the back, okay, the back of the knee, mine has torn off. So there are three types of wear and tear that can happen to your posterior root. It can either be a clean break. You know, someone fell and then had that snap, and it was a clean break. Or it can be like mine, where it's been, you know, like an outfit, as it wears and tears, it forms like a small hole. Then that small hole keeps on getting bigger and bigger, and then you can see the strands of fabric in between. So that's the kind of tear we are looking at. Now the doctor needs to go in and see whether there's still a little bit of shreds holding on to each other. If there is, he's just going to stitch them together. But if these shreds have completely separated, then he has to graft something to hold the two of them together so that it can remain strong. So that's the second surgery we are doing, which is the posterior meniscus root repair. Then the third surgery we are doing is we are going to drill, or rather the doctor is going to drill small holes into my femur. So we call them microfractures. So small fractures into the femur. Why? We believe that the body can heal itself. It has everything it needs to heal itself. So when we drill those holes into my femur, then it reactivates the body's plasma and platelets to then now come in and repair that joint. Remember, we have already shaved the bones off at this point. Then after we are done with micro drilling, then my doctor is going to take my own blood. He's going to separate it. So the red blood cells, which are the heaviest cells, fall down first, then your white blood cells, then you're left with your plasma and your platelets. Now, the job of your platelets is like when you cut yourself. You sometimes notice like it will clot, then in a couple of days, regardless of how big that space was, it will just join itself back together. So that's what the plasma does. Sorry, the platelets. The plasma is just the fluid that it passes through. So we're going to take that platelet-rich plasma, PRP. Now this is called regenerative therapy or PRP therapy. And we're going to take that plasma from my own body with rich platelets, and then we're going to inject it into the knee. Now this will be done on both my left and my right knee. The left knee so that we can completely heal the knee. The right knee so that it can hold on for a little bit longer before we do surgery on the right knee, because the right knee is even more damaged than the left, and it will continue to be that. It's just that my pain levels are higher on my left side. Why are we doing all this? We're doing all this to see if I can regain a better quality of life. Because of my knees, my hips have started degenerating, my ankles are degenerating, and my spine, which has spondylosis, is also degenerating. So we want to see, because the body will always align itself to see if it can feel better, to avoid pain. So we want to see, once we make the bones the way they should have been in the knee, if that will help my body automatically correct itself. That's reducing my pain from a daily 10/10 to maybe a 2 or a 1. So I really need your help. I have been in and out of hospital this year. I had insurance, it's over, I don't blame them. GA insurance has been one of the best insurances that I've been on so far. I've been on this chronic illness journey for 6 years. I've never asked for a fundraiser to this capacity. So now I need you to help me. Please, please, please donate as little as you can, as much as you can. Donate, say your prayers for me, and yeah, come and see me when I'm in hospital. I'll do a live tomorrow at around 11 a.m. to 1 p.m. because I'm supposed to be on nil by mouth, no water, no food, no nothing, as I wait for my surgery, which is going to be at 2 p.m. So I'll wait for you guys to join me then and ask as many questions as you can. I will drop my pay bill down below. Please, please kindly donate. I really appreciate it. Bye guys, and have a really, really good rest of the week. Peace out.